Hello, 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 and good afternoon, everyone. Thank you for tuning in to week 2 of our HIV Prevention and Education Summit. I hope you guys enjoyed our first week. We had some great speakers from ACO and from Gilead, and we had HIV one-on-one. And so this week, you are in store for another week of great webinars. So be sure to check out our website to register for this week of presentations. So today I have with us Dr. Keith Farmer, who will be sharing with us his lived experience of how he manages his HIV and diabetes using technology. But before we get into his topic, I want to let you know that the chat box has been disabled. However, you can ask any of your questions in the Q&A box below. And at the end of the presentation, you will we'll be asking your questions at the end of the presentation. If you have any thoughts or comments, use the Q&A box as well. And so without further ado, I'm going to introduce you to Dr. Keith Farmer.
All right. Nerves are a little bad. Chocolate always helps me wet my nerves. The reason why I use chocolate is because it helps me a lot with my nerves. I know it's not good for me. No, just using a prop. But if I was a cigarette, everybody would probably have gone crazy. But really, the reality of it is that, believe it or not, smoking does more harm than chocolate. So that being said, we want to get right into what it is that we're going to be covering today in today's presentation. First, I'm just pulling up everything. Just wanted to give everyone a quick, brief background. Went to Project Teach in 1999 and graduated from Project Teach. I struggled for many years in the beginning, just dealing with hepatitis and HIV. And in 2008, well, let's rewind back real quick. In 2007, I was told at that particular time that I was a pre-diabetic. I didn't understand that word because all through growing up as a child, I always heard people say borderline diabetic, borderline diabetic. So I didn't know that that was the same understanding by me not even being in the medical field at all. And I just want to really get that point across, is that anytime you want to change anything that you're doing as far as your health, it's always, always, always important to talk with your healthcare providers about those changes, especially when it comes to medication and medication adherence and adding medications or even over-the-counter things that could actually interact with your medication. So it's always important, even if you want to exercise. I want to stress that too, because there are so many factors that can really go into a person not being able to adequately do those things correctly if they haven't talked with their healthcare provider and find out the right plan that can suit you. And one of the things that I have learned is that we have great healthcare providers in this city, and nearly all of them that I'm aware of are always willing to work with patients and not just, you know, allow them to wander and not have any direction. So whenever you want to change, it's always important to really talk to your healthcare professional. And I did some very no-nos, and I want to get these out of the way really quick. But our objectives, what we're going to do and what we're going to talk about, there's really three big objectives that we have lined up for today. And that's to understand how to use smartphones to manage our HIV and diabetes. But I want to add just on top of that, what I found out through being a patient advocate is that there are people that have other and not even chronic illnesses or just medical conditions where they require to taking medication. For example, where I'm at, where I help a lot of patients, there's people with other ailments such as lupus. We have another person that just has dealing with taking a lot of mental health medications. And so we've been able to help those individuals as well utilize the technology to just do better with managing health and having better medical adherence. And we're also going to understand how to lower our A1C with tips that actually can change the way that we eat. And we're going to understand how to exercise with minimal efforts to gain maximum results. So with that, I want to take you on a journey. It was 1981. And in that journey, I was visiting Disney World. And there was a young guy, he might have been about 11 or 12, and his mom just stopped him right on the track and said, "Son, listen to me. I'm going to tell you something. If you don't understand how to operate computers, you best learn how to fix them, because only the people that know how to operate and only the people that know how to fix computers are the ones that are going to have a softer road in life. Those who do not know how to do either of those things, they are going to have a rough road in life." And she went on to talk about auto mechanics and she said, you know, the auto industry is going to change because computers are going to really take over in all areas of your life, and things that you won't even think the computers will be necessary or needed, they will be there too. But the auto mechanic that doesn't evolve with this emerging technology is going to be obsolete. And I'm looking at this whole conversation like, wow, obsolete. And she looks over at me and she says, yeah, because if they don't understand the computer element of that car, they're not going to be able to fix that car adequately. So I'm like, oh, wow. So I'll keep going. And at that point, I didn't realize that impact of that conversation, listening to it, how much truth there was to technology, and how technology has actually not just evolved, but how technology we can all utilize for so many different things. And one of the things that really got me on the path, and I have to say this because as one of the very first satellite AIDS libraries at Broad and Dolphin in the year 2001, that helped me really prepare more for all of the technology that kept emerging and kept emerging and kept emerging and continues to emerge today even more. So what I actually was able to really understand was it's so important to not just have the technology, but know how to use it. And I kind of skipped because I wanted to go to this part where it says, and my not going down. So one of the things that often happened, as I'm not being able to get my mouse to cooperate with me properly, was that as a kid, I was always called a gadget. And I was the child that, not that I was spoiled, but being an only child, I learned how to be a good negotiator. And when you're a good negotiator, what happens in that negotiation process was I was just so tired of getting gifts for doing my chores and getting gifts for doing good grades. I thought that I had a little bit more leverage. So I utilized that leverage to negotiate an allowance for me doing my chores and negotiate those gadgets for me acquiring good grades. So in acquiring those good grades, I was always the first kid on the block with like all the newest trinkets that were always out back then. And we're going back to the 80s when there was Casio watches, Sony Walkmans, all those things that came out. Because I had good grades, I was always the first kid on the block, on my block, with those gadgets. But what I was trying to reiterate was just because I had all of those gadgets, I was the kid that I just loved things. I didn't know how to maximize the power that I had at that particular time. I just had them to have them. Couldn't tell you how to operate probably 90% of the stuff that I had at that time. But I always had them. And so I was one of those people that kind of slowly transitioned into this whole, because, you know, I'm a child and I'm growing up in what we call this technical era of things happening and more things happening and more technological advances. And so with all of these different technological advances, I myself was originally told at one particular time that, you know, you might as well get ready because the end is near. And hearing those very drastic words in 1997 forced me to reevaluate my life and where I was at. And I really, at that point, wanted to learn a lot about what I was dealing with and how I could actually cope with HIV, if there was a such thing as coping with HIV. I didn't know that you could cope with HIV. There weren't people around me that were telling me that it was going to be okay until in 1999, I ran into Philadelphia Fight and I signed up for Project Teach. And they gave me some empowering skills that helped me be able to understand that not only is this something that you can manage, but it's something that it's not the end of the world. And so I was one of the people, I just knew that it was the end of the world. So moving forward, now that we're learning about HIV and we've got some information about HIV, and on top of having all of this information, because, you know, I like I said, in 97, I was given the information that I had HIV. I didn't want to do anything about it because I just really believed at that particular time that the end was quite evident. It's going to happen, and it's going to happen. So there wasn't no real concrete plans for my future, aside from, at this point, I just want to learn what I'm dealing with. How can I get better? Is there a possibility that I can get better? Is there a possibility? And so I was one of those, I don't want to say unfortunate, but I was one of those people that once I found out my immune system was extremely weak. So I was at that point have given the AIDS diagnosis because then they were saying the words T cell. Now we say CD4, but my T cell count was 13. When I was able to find out that I had acquired the HIV virus, but because my immune system was at such a weakened state and no medications, and we're going back to before the whole thing of PrEP had become available, because I had known some people that were secretly giving pills to other people. And I didn't know what that was about at that particular time. I just know that now we have a system and we know that it works to help people to not acquire HIV. So, you know, again, technology has done so much. But now we're moving forward, right? Because I want to walk you through this whole process here. So when we move forward, I didn't understand that. And we find out that there is no more, at this point, understanding, what I need to do, how I can get my immune system back on track. So I'm having, and I've been given all this information of what to do. And I just didn't know at that particular time, after being provided with like the wonderful information, how to really utilize this to the best of my ability. And I say that because having the information is one thing, but utilizing this information is a whole nother program. So what I wanted to do was utilize all this information and see how I could make it fit for me. And what I found out was, because at Project Teach, you get a wealth of information given to you in a short period of time. So it was a lot of learning. And what I continue to do, even to this day, is learn about the new medications that are happening. Now, come 2008, I get a rare condition. Didn't realize, I've heard of toxoplasmosis, but this condition was called ocular toxoplasmosis. And what this condition did was it caused 80% of the vision in my right eye to be gone at that particular time. So that's why I wear glasses. Until 2008, I didn't wear glasses. But because of the damage that the toxoplasmosis had caused, I lost 80% of my vision. In doing that, that was actually my wake-up call. And the reason why I say wake-up call is because I knew that I wasn't doing everything that I needed to do to be better. And the reason why I say that is because I had to learn how to be honest with my healthcare providers. And the reason why I say that is because I needed to tell them, I get the medication, but I'm not taking it, or I take it here and there. And my problem, to be honest, sometimes I would overtake the medication because I couldn't remember, did I take this pill? Did I take that pill? Dang, did I take that pill? I got to take this pill for this. And I'm telling you, I got all different kinds of pill boxes. I even got, well, we're going forward to last year, but before that happened, because I had a smart pill box finally last year. But before all of that, I said, there's got to be a way. There's got to be something that can be better than what I'm doing right now. Because, like I said, some days I'll get up and I realize I'm on track. I'm taking everything as prescribed. And then the next day, I might not take anything but one thing, because I was supposed to take this one in the morning, then I had to take this one with food, and then I had to take this one without food. And I would get all mixed up. Because when I'm supposed to take, then I would take stuff that I was supposed to take with food, without food, and the stuff that I was supposed to take without food, I was taking with food. So again, I'm losing my mind with this medication. So I went to my medical professional and I said, Doc, there has to be a better way. There's no way I can enjoy a quality of life when I am taking all of these medications. Can we have a plan, a game plan? This is all I'm asking for, Doc. I need a game plan. Me and you come up with that we can lower the amount of medication that I need to take. If we can do this, I'm sure I can be a lot better with taking medications. But right now, this is too much. And I don't know. I just had to be totally honest, because I found out that when you're honest with your medical professionals, 9 times out of 10, you're going to get the best possible care and the best possible help, and they can put you in the best possible direction for you to get better. So now I've addressed the problem. How do I address the issue? So the problem is too much medications. And we're talking about in 2008. We haven't come to, because I was well understanding of a lot more of the advances that we've had in the medication. I was one of those people that was reluctant to try the new stuff out. So I had to look at the part that I play in this whole position too, because I played a part. Like, you want to continuously take this older medication, but my way of thinking was that this older medication has been more established, and this older medication is a lot more trusted. What information that these medical professionals are providing is saying that, yes, it's passed through all of these levels, but it hasn't, there's not enough data aside from this to really support, in my mind, to make this drastic change when you have something and you see that it is working. So I continued to take X amount of pills, X amount of times, X amount of times, X amount of times. And then finally, like I said, with this whole diabetes thing, and like I said, I didn't understand that diabetes was my understanding of diabetes, first of all, was always that diabetes was for people that were either they ate a whole lot of food, or they had been, what we would say, exposed through genetics. So some people would, and that was, they've changed the terminology now, but when I was growing up, you only heard of juvenile diabetes. And then there was no such thing as adult diabetes. If there was an adult, it was just diabetes. But now they have this broken down into different classes. But that was my understanding. So that if I'm fat as a kid and I get diabetes, I'm going to have diabetes the rest of my life. So I didn't know, that diabetes in some people could be reversed. Because now my doctor is telling me that on top of all this medication that I have to take, I got to take medication for neuropathy. I have to take medication for the toxoplasmosis in my eye. Then I have to take medication for another nerve in my neck from a car accident. So that's totally non-HIV or diabetic related, but I'm just going through all these different medications. So there was 3 medications that I had to take from the car accident, then neuropathy medication, then hepatitis medication. So I'm going through it, and I'm telling my doc, look, there's got to be some kind of way, because I can't manage. And look, we tried all different kinds of different pill containers, the ones that tell you the morning, noon, and evening pills. Then we got the one where it's a whole big case and it's broken down into 4 sections of different time periods where you take it. So there's like the dinner time. It says breakfast. It says breakfast, lunch, dinner, and bed. That's how it said. So there was stuff that I would take with breakfast. There was stuff that I would take with lunch. But then I had to remember, because I was putting pills in there that I wasn't supposed to take with food. So then I had to have those pills separated on another side, because I didn't want to get confused with the stuff that I needed to take with food and the stuff that I didn't need to take with food. And again, I'm getting confused. I'm not really understanding this whole diabetes thing, because like I said, my understanding was you had to be, most people that were very big were more prone to get diabetes, because there are people that are large that don't get diabetes. So I didn't know that I'm what they would call that pre, and I would say, well, what does that mean, pre-diabetes? Please explain to me pre-diabetes, because I'm like, either you have something or you don't. I don't understand this pre. So does that mean I'm more susceptible to get diabetes? Does that mean, because I'm already dealing with a lot? You know, I've got all this stuff, all this medication that I'm already taking. I don't need nothing else to upset what's already going on medically with me. So the doctor said, you know, at this point, so this is what needs to be done. You need to monitor what you eat. And I don't do that. I monitor every McDonald's, I monitor every Burger King, I monitor every Wendy's, monitor every fast food place. I love to eat. I'm not ever going to lie about that. And so I said, well, doc, we're going to have a problem because I'm not going to stop eating. So what next? Because right now, I don't see this happening. So, well, Mr. Farmer, if you don't change, you're not going to be pre-diabetic anymore. You will be a diabetic. And based on the work that I see from the blood work that we've done, this can be very serious. So I'm more concerned about you becoming a diabetic than I am about you managing your HIV right now. I said, doc, I ain't even managing my HIV. Are you serious? I'm not managing my HIV. I know that. And I know that the blood work shows it. So my thing of it is let's not lie to each other, doc, please. You know, by the blood work that I'm doing, that I'm not taking my medication because it's clear and it's evident my numbers aren't getting better. The numbers are getting worse. So what do I need to do to get better? Again, I asked the question because I said I have to be better. But and I can't, and this was me saying it in all honesty, I already had a lot on my plate. I did not want diabetes on top of what I was already doing because I already have to take medication for this, medication for that, medication for this, medication for that. And so now you got to take medication for diabetes. So now, look, so moving forward, we in December of 2008, it was finally brought to the bloodworks attention that I was no longer considered that in that stage of being on the border, I had crossed the border. So now I am in a position, I've crossed the border. What do I need to do now? So my doctor is telling me I have to take a pill and insulin before I eat, and then I have to take insulin at night. And I'm like, on top of everything, no, you're messing with me. On top of everything that I'm already taking, you want me to take more medication? And our job, our goal, our what we already agreed on was that we were going to reduce the amount of medication. What's going on? Why are we not on the same page, Doc? Didn't we just have this conversation that this was our goal, was to reduce the amount of medication? Sorry, but this is what happens when you don't follow through with, you said you were going to take care of it. I meant I was going to take care of it, but not the way that you heard me say that I was going to take care of it. I meant that I wasn't changing. And because I didn't change, I got what I got. So now I have to deal with the repercussions of adding more medication on top of the medication that I'm already taking. And so the first thing that really helped me in my journey was just checking out Calendar when we're talking about technology. And so what I did with Calendar was I just put all of my medications, because this was before I knew about a medication app. So we're going back to 2010 now. So from 2010 to like 2015, I used Calendar to help me out. And that's a good starting point for anybody, actually, is because Calendar is on every phone. And the one thing that I love about Calendar is because I was always thinking that there wasn't enough room to put everything, but Calendar I used to describe, to help me out in the beginning, because I wanted to see what was affecting my diabetes. So that was my onset of thinking in the beginning, was to see what was making, what's the relation to why are the numbers going up, why aren't the numbers going down? So every meal I would write breakfast, what I have for breakfast, and I would write it down. And then on the same day, I would write lunch. And I didn't realize until I got to dinner that, wow, it can cover breakfast, lunch, and dinner, full meals right there in calendar. And I would write that consistently. Like I said, until 2015, I found the app. I believe it came out in 2014, though. My history serves me right. It came out in 2012, actually, because it's been around for 10 years. So I go on the app store and I look for medication apps. And I'm trying to figure out, something that will help me just deal with remembering to take my medications. And then I realized that I could use calendar, because calendar, you can actually set reminders to remind yourself. And what I was doing was, so that I didn't get confused, there were certain medications that I couldn't take with food. So I would say no food with this medication, to remind myself that I didn't need to take food with this. And I could put it all on calendar and it would all come up very clear. And there was no confusion for me initially. But then what happened was, I was messing up by accident. And I have to say it this way, because I was reading the medication and trying to take it as prescribed, but for 2 days, I took the wrong medication at the wrong times. And like I said, it was an accident. It wasn't on purpose, and I wasn't trying to mess my body up at all. But what happened was, after realizing that I had done that for 2 days, what I did at that point was I put all of the stuff that I needed to take at night in one side, and all the stuff that I need to take during the day on another side. And I was able to put in calendar the day medicine, night medicine, and then all the medicine that I needed to take that didn't require me to eat. So moving forward, 2015, the app called MedHelper, and this app, it just does so much, as far as once it's set up, and I'll give people this much information, because a lot of people that I've helped with this particular app, a lot of people say that the app is very, it's confusing. And I am by far one of them people that have a lot of technical savviness. When it comes to technology, I was the last one to let go of my flip phone, because I love my flip phone and I wasn't trying to keep moving and try to keep up with the Joneses. I just loved my flip phone. Finally, I found a phone that I liked and I was comfortable with it. And so to get rid of that flip phone, it took a lot. And now we're in this smart age with these phones. And I said, well, this will help me. So I looked on it, and it actually has a medication log. So when you go to the medication log, what it'll briefly do is allow you to log in all of the different medications that you take. And I thought I had one sitting right here, but just to give you a demonstration, and the cat knocked it over. So I'm gonna move on. I see that you knocked it on the floor, and I'll get it. But what happens is you put that information, and it will also allow you to track how many pills you have, as well as the times that you need to take them. And if you need a reminder, you can also at that point be reminded that is when you need to take this particular medication. On top of that, what it also does, and one of the other features that I like, is that when you put your medical provider, whoever was the medical provider that prescribed that particular medication, what the app will do is, say, for example, and I'll give you my situation, my personal situation, because I had to see a liver specialist, I had to see a kidney specialist, I had to see my regular doctor, and I had to see an eye doctor. I have all four of those doctors in here because I'm getting different medications from all four of those doctors. Now, the other thing that is so important, and I stress this with the utmost importance, if you don't remember anything else, if you go to different doctors, always make sure that all the doctors, all of them, are aware of all the medications that you take. The only reason I'm saying that is because I almost messed up big time. And thank goodness for pharmacies that are also trained to catch any little mistake when it comes to medications. And they recognize that I was prescribed a medication that I'm allergic to. So because this pharmacy was aware that I was allergic to this particular medication, because it wasn't the actual medication Bactrim itself, but it was a medication that actually had Bactrim as a component. I don't remember the medication right now off the top of my head, but I just remembered that that was the component in that particular medication. So understanding that that Bactrim was a particular medication that I'm allergic to, the pharmacy immediately alerted the writing prescriber that he's not allowed to have this particular medication because he's allergic to it. Even in low dosages, I have a tendency to have high allergic reaction to that particular medication. So it also gives you a spot on the app so that you can also put on any allergies that you have. And on top of the allergies, once you do the medication log, you can actually put any appointments that you may have. And what I've been able to do more recently, and when I say more recently, like within the last 2 years, is because I have 2 grandchildren. I have their medication information. So when they come over, I know how to properly give them their medications that they require. So at the very bottom, there's a slot called profile, and you can just add as many profiles as you would like. And then under each particular profile, so I'll click on my grandson, Paul, and it has all of his appointments, pharmacies. He goes to the same pharmacy I go to, Pharmacy of America. Then it has all his doctors and any notes, all his prescriptions, and his inventory of all of his medications. So what I really love about that particular app versus just using, for example, just the regular calendar, is everything is a lot more concise on the app, because with the calendar, it's just real, it's too simple in the sense that it doesn't break you can put appointments, yes, you can do all of that stuff, but it just puts it in a more in a better flowing a situation when you can just look at your appointments versus where you have all of this stuff written on your calendar for one particular day, which is what I was doing. And to be honest, sometimes I did confuse myself, but like I said, this app will actually makes things so much more easier. But for people that start, it's always, I don't not recommend using calendar, because if you're not really that technical savvy. But the good thing is that any provider that I'm aware of, especially in our city, they are more than happy. And I've talked with Philadelphia Fight, I've talked with Esperanza Healthcare, I've even talked with the HIV specialty care at Temple, and I've talked with University of Penn as well. All four of those places are willing to help their patients get this system together on their phone. So if somebody gets that app and they're not really comfortable about doing all of that, I'm sure that there's so many other smaller organizations and clinics that have the resources, or people that would be willing, or nutrition specialists would be some of the particular that I've heard. This when I went to University of Penn, they told me that, oh, we have a nutrition specialist that would do that for our patients. So, you know, so if somebody, for example, is not that technically savvy, they can actually get assistance from their healthcare providers, because like I said, once you have all of the information from all your medications and it's put in that first time, it's so much, it's like a easy flow with the medication, and all of the different time periods that you're supposed to take the medication. So what that particular app did for me was it helped me not just remember about taking medications. I wasn't overtaking my medications anymore. And that was important, because like I told you earlier, I was the one I would not take medication because I don't remember and then I would overtake medicine. And I know that that's, you know, I'll put it this way, I'm more aware the dangerousness of that. But being able to take the medication as prescribed, when it's prescribed, and being able to adhere, that played a big part. Now, the other thing that I really wanted to stress was, like, I knew that it wasn't just going to be technology alone to manage HIV and diabetes, because on the actual app, what you can do is there's a section that you can put notes. So what I've done with the note section in the app was I just wrote the progress of my lab reports from every time that I've gone to have blood work done, so that I have one centralized location where anything medical I can look at. And I'll have to worry about, oh, the doctor's appointment is over here, this is over here, my medicine is over there, this is over there. And it makes it so much more manageable and so much more easier when you can access everything from one centralized location. And like I said, in the beginning, you know, I was writing the doctor's appointments, the dental appointments. Like I said, I was a liver specialist, and I had to see a kidney specialist. Am I missing a doctor? I feel like I'm missing a doctor. Oh, my eye doctor from the ocular, because I had to have a consistent monitoring for a while with the ocular toxoplasmosis that had happened. So for taking medication for the eye, and, you know, all those different medications. So somebody that's not as medically complex, I don't want to say the wrong word. So somebody is not as medically complex as I was, it can be a lot easier, and it's a much more better managing situation. But the one thing that always evaded me in that whole process is, none of this is going to work if you and your doctor, remember I said earlier, me and my doctor had already made a goal. Like, the goal was for me to lower my medications, not to have my medications increase. So now we're at the part where the medication has increased. Why has the medication increased? Because you have an additional diagnosis on top of all your diagnoses. So your medication has increased. Again, I said, Doc, what needs to happen for me to be done with this whole injecting myself. Look, I am the one person, because initially I had tried a particular type of diabetes medication called metformin, and I understand that everybody can have different responses to that particular medication. My response was not a productive response. My response had me stuck in the house, literally stuck in the house. I could not manage to stay out of the bathroom. That's how much I was stuck in the house. And, the doctor kept saying, keep trying it, keep trying it. And for 3 months of trying this medication, the doctor was finally convinced that this medication is, maybe it's not going to work for you, so we need to try something else. So that's when we went from just to try the pill twice a day to the insulin injections before eating, because I was always under the understanding that there was fast-acting insulin, and then there was fast-acting insulin, and then there was like long-acting insulin, where it would take a longer period of time for that insulin to act. So I would just say daytime insulin to not confuse myself, and this is my nighttime insulin, because I had to take insulin when I go to bed, but then I also had to take insulin before every meal. So in taking all of this medication, including the HIV medication, including the hepatitis medication, look, I wanted simplicity in my life. And I realized the only way to get simplicity is you have to do things simple. It, like a light bulb went off. Do things simple. Like, why are you eating 3 and 4 plates of food at one meal when you know you're dealing with something where your doctor is more concerned that you're going to die from diabetes than HIV? That should be a wake-up call, man. Listen to what your doctor just told you, dummy. I'm talking about how I had to talk to myself. I had to tell myself that because I was still not believing, not completely understanding that I've got all this extra medication, but I'm not changing. The only thing that I'm doing correctly is taking the medication as it's prescribed. So now, as of realizing that I can take this medication as prescribed, I realized that I need to do something. If I want to get off the medication, maybe I need to make a change. And I showed you these pictures here when I talk about the struggle of medicine adherence is real. And I was always the person. Look, I didn't care about being a little overweight, because I came from a loving, caring home that we were taught how to love people and always see the beauty of people on the inside. And it wasn't their exterior that mattered, it was the person's heart. So I came from a loving home, so it didn't matter that I was 5 feet 6 inches and made it to 280 pounds. They still loved me the same. I had to learn that maybe I need to love me differently. And what I mean by that is that I didn't lose weight because anybody told me that I was fat. So I want to make that very clear. I didn't lose weight because people told me that I looked like I was maybe 5 or 6 months pregnant. I lost weight because my doctor said maybe, just maybe. So this is the maybe part, right? The doctor said, maybe if you lose weight, there is a possibility that we can reduce the amount of insulin you have to take. So moving forward, we're going to this technology, and I'm seeing how all of this is playing a part. I'm utilizing the app, but I'm not utilizing the right foods. Not utilizing the right foods. I'm not doing the things that are conducive to healthy living. So what I did was I got rid of, first of all, let me tell you what I did. I got rid of every single plate in the whole house. I did that for a reason. I said, maybe if I stop piling my plates up, that can make a difference. So instead of having the real big giant plates, I got smaller plates. Smaller plates means smaller portions of food. Now, listen to me. I'm not trying to really minimize this. I realized that my life was in jeopardy. So I had to just not adhere to the medication, but I needed to do something because now the light bulb is going off. If I can lose the weight, there's a possibility that I can have less medication. That sounds like a win-win for me. So now I'm going to every store I can find. I'm getting portion control containers now. So I put the portions in the containers. And I'm still, with the app, I'm still putting in the app every day all the foods that I eat every day. All the foods that I eat, breakfast, lunch, dinner, or if I skip lunch, or if I skip dinner, or if I just had dinner that particular day and I decided that I wanted to have a healthy vegetable shake in the morning. And when I say that, I'm not saying it because I knew that there needed to be change. Did I want change? No. I was very resistant to change. I was very resistant to technology. The reason why is because it seemed like every time I turned around, I was the last one to find out about everything. When MySpace came out, by the time I got MySpace page, it was Facebook was the thing now. So I always felt like I was always behind when it comes to technology. So I said, you know what? It's got to be something better. There's got to be something better. And what I need to do is I need to really understand that I've got to treat myself better. I can't, and I have to say it this way because I was the person who always tried to fix other people, not realizing that I needed to work on fixing myself. And when I say fixing myself, I want a whole person in my life, but I am not a whole person to begin with. How can I attract something that I am not? So I had to really take a whole 360. And when I say 360, I really mean a complete turnaround, not a partial turnaround, a complete turnaround, and evaluate the way I eat, what I should be eating, and what I shouldn't be eating. And that's why I stressed in the very beginning, it is so important if you're going to do exercise. Because one of the things that I did, and I'm standing up, so I actually had planned on being seated, but I just feel a lot more comfortable standing up because I was going to do some chair exercises that I was doing during this pandemic that played, I would say, 80% role in me losing weight because I was very lazy. I'm going to be completely honest about that. I didn't want to exercise. I didn't want to do that, but I wanted the change. And that was what was so important, is because I wanted the change. And I knew in order to have change, I needed to do change. And in order to do change, at this point, I've got to be willing. And I got to understand that, look, this is a complete lifestyle change. It's hard. When you go from a size 40 waist, and now I'm a size 36, 280 pounds, now I weigh 161 pounds. Um, all of my friends through this pandemic have gained weight significantly. But I've been consistent through the pandemic of doing things differently, utilizing the technology that we have to help me stay on top of my medication, and not just stay on top of my medication. The other apps that are on there are basically fit apps, and one of the biggest ones for anybody that uses Samsung, because Apple has their own version of the app too. It's Apple Health, and for the Samsung users, it's called Samsung Health. And that particular app helped me understand that even if I don't exercise, at least walk. At least walk. I mean, that's the least that I could do and know. So what I decided to do was get a dog during the pandemic, because I said that would give me a little bit more encouragement to walk. So I did those little things to just help me better move along. So understanding all of that, the technology it's going to continuously move. They'll probably have an app next year that tops that app. And the reason why I said it is because if you look at all the apps that are out there, the apps are always getting updated. They're always being improved. And that's because of feedback that goes back to those developers that say, well, we like this app, but this. And one of the feedback suggestions that I gave the app early on was just to have a section for notes. And I was shocked that they thought that that was a great idea, and they added the note section. And I said, because that way, if I could just write down these little extra things, when I see that my numbers are high, well, this is what I ate this particular day. That's the reason why my numbers are high. Or maybe I forgot to take my insulin before. But as I stand here before you, in the condition that I am in a much better state of health, I am proud to say that by doing the complete drastic change, I was able to not just eliminate the amount of medications that I take, but also eliminate the usage of the insulin. So as of June of last year, I have just been on one medication for the diabetes, and it's called Trulicity. And with that medication, I log it in to my app, and it reminds me every week that I take that particular medication. I started taking it on Tuesday. I've been taking it every week on Tuesday. So it reminds me, it's Tuesday, it's time to take your Trulicity. And that is one of the beautiful things that I love about this. So I want to close and bring it home with that story that I was telling you in the very beginning. Remember the young child and the mother, and they were talking. The mother was talking to the child about technology, and the child said, "What do you mean computers are going to take over?" And the mother then explained how, that with all of the technological advances that are being made, that if that auto mechanic doesn't get with the program and understand that they need to understand the computer components that are about to be put in the car, that they're going to be obsolete. And so you need to know how to operate a computer, or you better know how to fix one. So when understanding that, we can always use technology to help us in any aspect that we're dealing with health. I want to thank you for your time, and thank you all for listening.
Hello, hello, hello. Thank you, Keith, for sharing your lived experience with your various ailments around diabetes and HIV, and some of your own personal struggles. I want to first thank you for your transparency and your willingness to share of yourself about your personal struggles, and just being really open and honest with the viewers of how you got yourself back on track by recognizing where you were struggling. And so kudos to you for your courageousness and using this platform to hopefully inspire others who are watching, but also to share some of your own wisdom that you learned along the way through your own experiences. So thank you, Keith, for sharing. Those of you in the audience, all right. So if you have any questions for Keith, please ask your questions in the Q&A box, so that he can answer the question the best up to his ability. And we do apologize about his slides. He was experiencing some technical difficulties initially, but he was able to get his slides together. Any questions you have for Mr. Keith Farmer? Any questions? Okay. If not, then we're going to wrap up then with final words. Keith, do you have any final words for our viewers? You have to unmute yourself.
My mouse died. I just want to say what an honor it is to be here. And again, if I don't think anybody takes anything else home from all of that, is that it's so important that we talk with our medical professionals about any change that we want to make, regardless if it's diet, exercise, because everybody is treated as an individual. Not just at Philadelphia Fight, but just about every single healthcare professional that I'm aware of in this city treats all patients as individuals, and there's as individuals, there are different medical circumstances and situations that one person may be dealing with and somebody else may be dealing with something totally different, which will allow this person to maybe have a more rigorous exercise program, but somebody else might have to have a more slower pace exercise program. So don't just jump into it. Always talk with your healthcare professionals before you try to do any change. Thank you.
Thank you, Keith. And for those of you who are still with us, check out our webinar for the rest of this week. You do not want to miss our Wednesday webinars. We have some powerhouses that's coming to speak with you from Texas and from all over the US of A. And so I invite you to check out our website and schedule to be in attendance to our Wednesday webinar. Until we meet again, you guys have a great rest of your day and week. Take care. Bye.